Hello everyone, today we will study about the deep cervical fascia. Okay, so first of all we have to know about the fascia. Fascia is simply the covering of our body. So the outermost layer of our body is covered by the skin. Okay, below the skin there is a fat layer as well as some connective tissue. Then there is superficial fascia. So below that superficial fascia there is again the fat layer. Again there is deep fascia. Then at the deepest there is muscle. So this is the layering of our body. Okay, this way our body is covered at different places. Now these fascia, they are named at different names according to their location. Okay, so for example, if they are present around the cervical vertebra, they are known as cervical fascia. And we are going to understand about the deep cervical fascia. Okay, deep cervical fascia means that is just above the muscle. Deep cervical fascia. Now this deep cervical fascia, it has 3 to 4 modifications. Okay, and among them prevertebral fascia, pretracheal fascia, and investing fascia. These are the 3 important modification of the this deep cervical fascia. So you can see in this figure, this is the transverse section of the neck. Okay, and in this transverse section you can see this is the cervical vertebra. Okay, this is the body of the cervical vertebra, transverse process and the spinous process of the cervical vertebra. Okay, at the center you can see this is the vertebral column containing the spinal cord. Now this cervical fascia at the periphery. Okay, so this is investing fascia. Okay, and this investing fascia, investing means it is giving some part so that the muscles get covered, so it is doing investment. Okay, and that's why it is using its layer to cover the muscle, so it is known as investing layer, investing fascia. Now this investing fascia, it is going and covering all around the body. Okay, so on the left as well on the right side. So this investing layer or investing fascia, it will cover all around the body. Now what are the muscles that it covers? Okay, so anteriorly if we see, this is sternocleidomastoid muscle. Okay, on the both side there will be sternocleidomastoid muscle, whereas posteriorly it is splitting into 2 layers and covering the trapezius muscle. Okay, at the posterior it is covering trapezius muscle. So this is important. Okay, it is covering 2 muscle. One is sternocleidomastoid muscle and another is trapezius muscle. So this is investing fascia. So another fascia we have prevertebral fascia. Okay, we have prevertebral fascia. So this prevertebral fascia means that is present just anterior to the vertebra. So this one, this is prevertebral fascia. Okay, this one is prevertebral fascia, and it is present just anterior to the vertebra, and it is covering the muscles that are paravertebral muscle that are present just parallel on each side of the vertebra, and the muscles that are present just anterior to the vertebra, these are prevertebral muscles. Okay, so these muscles, that this one is scalenus. Okay, scalenus anterior, scalenus medius, scalenus posterior. Okay, these are the 3 muscles. And we need to understand next fascia, that is pretracheal fascia. So this one is trachea, and just in front of trachea there is a gland, that is thyroid gland. This is thyroid gland, and the fascia that covers this thyroid gland anteriorly, this fascia is known as pretracheal fascia. Okay, this is known as pretracheal fascia, and this pretracheal fascia, it forms the false capsule of the thyroid gland. Okay, false capsule. The true capsule of the thyroid gland, it is formed by the condensation of the stroma of the thyroid gland. So that will be the false capsule of the thyroid gland. Now the important structure that is found by these fascia, these three fascia, that is carotid sheath. Okay, we need to understand about the carotid sheath, and this carotid sheath, it is the neurovascular compartment of the brain. Okay, so this is very important. Now in this other figure you can simplify it like and one exception we need to understand that maximum all the muscles of our body, they are present just below the deep fascia, but there is an exception, the platysma muscle. Okay, platysma muscle, this platysma muscle, it is not present deep to the cervical fascia, it is present just beneath the superficial fascia. That is only a exception. So we should know about the deep cervical fascia. What is the extension of this deep cervical fascia? Superiorly, inferiorly, okay, laterally and anteriorly. So what is the extension? Okay, so for that we should see this figure. Okay, we have this figure. In this figure, what we need to understand, superiorly the extension of the fascia, deep cervical fascia, superiorly it start from this point. Okay, this point is known as, so from this external occipital protuberance there is a rising of line. Okay, that is superior nuchal line and inferior nuchal line. So this deep cervical fascia, it passes through the this superior nuchal line, then it reaches to the mastoid process. Okay, mastoid process, then it reaches to the cartilaginous part. Okay, it reaches to the cartilaginous part of the external auditory meatus process. It reaches to the inferior, okay, inferior border of the zygomatic arch, inferior border of the zygomatic arch, then it reaches to the this mandible. Okay, this is the angle of the mandible, lower border of mandible, then it reaches to the symphysis menti. Okay, symphysis menti, it is a secondary cartilaginous joint. Okay, it is a secondary cartilaginous joint similar to the pubic symphysis of the hip bone. So this way superiorly, this is the boundary for this cervical fascia. Now it goes similarly down, and in the down it will be attached with the nuchal ligament. Okay, it will be attached with the nuchal ligament, and this nuchal ligament, it arises from, this nuchal ligament actually arises from external occipital protuberance to the C7 cervical vertebra. So this is the down attachment. So I think you have got all the points, so we need to see some important points, important MCQs related to the deep cervical fascia. So deep cervical fascia is also known as fascia of Colli. Okay, it is also known as fascia of Colli, and if the schematic diagram for the deep cervical fascia, you can see here in this figure, the outermost layer, that is investing layer. Okay, the outermost layer, that is investing layer. So this is the TS. Okay, this is the TS of the cervical vertebra shown here. Okay, TS of the cervical vertebra. Now next we have this. Okay, this is the investing layer, and this investing layer, it covers the sternocleidomastoid muscle, then it goes behind. Okay, so this way. So if we see the schematic diagram here, this is the TS of the cervical vertebra, or TS at the level of the neck, and you can see here this is the investing layer. Okay, and this investing layer is going behind. Again, this is the investing layer, and it is covering the scalene medius muscle, scalene medius, and next is it covers the posteriorly trapezius muscle, and the fascia that is present just anterior to the vertebra, that is prevertebral muscle. Then the fascia that is surrounding the thyroid gland, that is pretracheal fascia. Now this is the carotid sheath shown here. Okay, now this is the cervical vertebra. So we need to understand some important points here, and the important points is this carotid sheath. Okay, the content of the carotid sheath. So carotid sheath contains three things: one, internal jugular vein; another, the vagus nerve; another, common carotid artery. Similarly, this scalene anterior and this is scalene medius muscle. So between these two muscles there is brachial plexus. Okay, brachial plexus, and just anterior to this scalene anterior muscle there is important nerve, that is phrenic nerve. Similarly, in between the trachea and the esophagus there is recurrent laryngeal nerve. Okay, recurrent laryngeal nerve, and that is present in the tracheoesophageal group. That is present in the tracheoesophageal group. Okay, next we have to understand each topics. Like first we have the pretracheal fascia. So this pretracheal fascia, the main content of the pretracheal fascia is thyroid gland. Okay, it is thyroid gland and it forms the false capsule around the thyroid gland. Okay, and the true capsule of the thyroid gland is actually formed by the condensation of the stroma of the thyroid gland. And next fascia we have prevertebral fascia. Prevertebral fascia, okay, just and anterior to the vertebra. Now the extension of this prevertebral fascia into the axilla by the brachial plexus. Okay, brachial plexus, it is formed by C5 to T1. Okay, that is known as axillary sheath. Okay, so axillary sheath is the extension of the prevertebral fascia. We can see in this figure. So this is what, this is your fascia, that is prevertebral fascia, and this prevertebral fascia, it is extending, okay, down below the clavicle as axillary sheath, and this axillary sheath contains the brachial plexus as well as axillary vessels. Now we should know about the carotid sheath. So this carotid sheath, we can see in this figure, this carotid sheath, the content. Okay, what are the content of this carotid sheath? Okay, so how the carotid sheath is formed? Okay, so this carotid sheath, it has the wall. Okay, one is posterior wall, another is anterior wall. Okay, so this, its posterior wall is contributed by the prevertebral fascia. Okay, posterior wall is contributed by the prevertebral fascia. So this is your prevertebral fascia and this is the carotid sheath. So this is the posterior wall of the carotid sheath. So the posterior wall of the carotid sheath is contributed by the posterior wall of the carotid sheath is contributed by the prevertebral fascia, whereas its anterior wall is contributed by two fascia. This one is pretracheal fascia and this one is your investing layer. So the anterior wall is contributed by two. One is investing layer as well as pretracheal layer. Now this is the wall of the carotid sheath. Now what are the content of the carotid sheath? Carotid sheath contains one, this is your common carotid artery, and this common carotid artery, it is dividing inside the carotid sheath into one external carotid artery, another is internal carotid artery, another we have vagus nerve, and third we have the internal jugular vein. Okay, so some additional contents are also present in the carotid sheath, and they are, one is common carotid artery, internal carotid artery, internal jugular vein, vagus nerve, and the additional one is cranial nerve number 9 and 11. It is glossopharyngeal nerve and accessory nerve. Now we need to understand some MCQ. It may make us confused that external carotid artery is not the content of the carotid sheath. External carotid artery is not the content of the carotid sheath. Okay, now we know that in the brain we have the cranial foramen, and this cranial foramen, it consists of many foramens. Okay, among them one is jugular foramen, and this jugular foramen, so it contains three nerves. What are the three nerves that are passing through the jugular foramen? One is ninth cranial nerve, 10th and 11th cranial nerve. Okay, 9, 10 and 11. Among them, these 9th and 10th cranial nerves, they do not travel all the way through this carotid sheath, but they travel superior part of the carotid sheath. Okay, so they also be the content of the carotid sheath. Now you can see clearly in this figure. So this it is showing the common carotid artery dividing into external carotid artery and internal carotid artery, and this one is the carotid sheath. Okay, now we need to know the relation of the carotid sheath. Okay, so relation of the carotid sheath, posterior relation of the carotid sheath, there is presence of the sympathetic chain, whereas anteriorly there is ansa cervicalis, and this ansa cervicalis, it is embedded inside the carotid sheath. Okay, ansa cervicalis. Now this is the relation of the carotid sheath and the ansa cervicalis. It is a loop like structure that is present on both the side. Okay, if we cut on the TS, it will be look like only we can see the descending part of the ansa cervicalis. Okay, so posteriorly we have known that there is sympathetic trunk. Okay, now the fourth modification of this deep cervical fascia is investing layer. Okay, and this is the investing layer, and this investing layer, it encloses muscles, spaces, ligaments, pulleys. Okay, and these, it will enclose these things in two in number. Okay, for example, it encloses two muscles. Okay, what are the two muscles it includes? It includes trapezius muscle, sternocleidomastoid muscle. I have already shown you in the diagram. So two muscles, they are trapezius muscle and sternocleidomastoid muscle. Similarly, it encloses two glands. Okay, one is parotid gland. Okay, another, it encloses submandibular gland. Now it encloses two spaces. What are the two spaces? One is supraesternal space and supraclavicular space. Okay, so the supraesternal space, also known as burn space. And the content of this burn space, they are, one is the external head of the right and left sternocleidomastoid muscle, jugular venous arc, some lymph node are also present there. Okay, another is interclavicular ligament. So these contents are important. Another, we have the supraclavicular space just above the clavicle, supraclavicular space, and the content of the supraclavicular space, they are external jugular vein, supraclavicular vein, and cutaneous vessels as well as lymph nodes. Now it also encloses two ligaments. Okay, what are the two ligaments? One is stylomandibular ligament, stylomandibular and sphenomandibular. Okay, stylomandibular and sphenomandibular ligament. Okay, so we have the muscles that are that have the belly. Okay, so at the center they have the pulley. Okay, so the one anterior belly, posterior belly, superior belly, inferior belly. So first we have the digastric muscle and omohyoid muscle. Okay, digastric muscle and omohyoid muscle. So it will form that pulley. Okay, these fascia, they will form the pulley and divide this muscle into two corresponding bellies. So the two important muscles, they are digastric muscle and omohyoid muscle. These are important muscle that forms the boundary in the case of the triangle of the neck. Okay, so these are important. And next we have understood about the sagittal section of the neck. Okay, if we see the sagittal section of the neck, we can appreciate the different layer of this cervical fascia, deep cervical fascia, and we can easily see that. So in the sagittal section of the neck, at the posterior end, you can see these are the cervical vertebra arranged in the line. Okay, these are the cervical vertebra. Just anterior to the cervical vertebra, we will see the prevertebral fascia. Okay, just anterior to the vertebra, there will be this prevertebral fascia. Okay, this is the prevertebral fascia. Again, this is the pharynx. So fascia that is present around the pharynx, that is known as buccopharyngeal fascia. Okay, that is known as buccopharyngeal fascia. Okay, this is buccopharyngeal fascia, and this prevertebral fascia is actually divided into two layer. Okay, it is divided into two layers, split into two layers. One is anterior layer, another is posterior layer. Anterior layer is also known as alar fascia. It fuses at the lower end with the buccopharyngeal fascia and form a space just behind the pharynx, that is retropharyngeal space. Retro means just behind pharyngeal, so just behind the pharynx there is a space that is known as retropharyngeal space, that is known as retropharyngeal space. Okay, and this retropharyngeal space, this is completely closed space. Okay, at the above there is the base of the skull, whereas at the below it is fused with the buccopharyngeal fascia, so it is a closed space. So if there is any infection, any pus that is present in this space, it won't spread above or below, it will remain that there only. Okay, but the next space that is formed actually by this alar fascia and the prevertebral fascia, this space is known as danger space. Why it is called as danger space? Because this space is open downside, and this space actually reaches up to the mediastinum, posterior mediastinum. So any infection if that comes in this region, arises from this region, that may spread up to the mediastinum, the structure present in the mediastinum. It might be trachea, it might be heart, okay, lung and other, and it might also spread behind. Okay, this is the vertebra, it can also reaches to the vertebra, mostly the tuberculosis. Okay, so tuberculosis of this cervical vertebra, that will spread into this danger space and reaches to the downside, or from the lungs it might spread up to the vertebra. So this way this danger space is very potential space. Okay, and due to the infection, it might, the symptom, the patient will present with dysphagia. Okay, problem in swallowing the food. Okay, there will be dyspnea. Okay, and there will be also shifting of the trachea based upon the infection, different category of infection. There will be the shifting of the trachea against the midline. Okay, away from the midline toward the midline. Okay, we have to understand. So in here we can appreciate one MCQ has been asked in the past question. Okay, in the AIMS as well, what they are asking is that they have labeled the different layer and they have asked which one is the danger space, or which one is retropharyngeal space, which one is alar fascia. So we need to appreciate every layer. Okay, so you can appreciate here, this one, this whole is the vertebra. Okay, this one is the cervical vertebra, and next you need to understand this one is the skin. Okay, this one is the skin, and this fascia, you can see this fascia is the outermost layer. Okay, this is the investing layer. Okay, this is the investing layer, and this fascia is actually prevertebral fascia. Okay, on the both side here also, this is also prevertebral fascia. Okay, both are prevertebral fascia. And next what we have to understood, this is your prevertebral fascia, and this is your alar fascia, and this is your buccopharyngeal fascia. So we need to understand the space in between them. So this is the buccopharyngeal fascia. Okay, and this space is actually retropharyngeal space, whereas this is alar fascia and this is prevertebral fascia. So this one will be the danger space. Okay, so this is the space, and you can see the fascia extension here. Okay, so in this figure you will better understood what is the extension of the fascia superiorly, inferiorly, anteriorly. Okay, you need to understood this is your ligamentum nuchae. This is known as nuchal ligament, and from the nuchal ligament there is this nuchal ligament arises from the external occipital protuberance and goes up to the spine of the C7 cervical vertebra. Okay, that is the extension of the ligamentum nuchae or nuchal ligament. And anteriorly if we see, okay, anteriorly if we see, the fascia extend from here, then it reaches up to the external auditory meatus, cartilaginous part of external auditory meatus, then the arc of the zygomatic arch, then this angle of the mandible, then lower border of the mandible, then it reaches up to the symphysis mentae. So from this symphysis menta it will goes down and connect with the body of the hyoid bone, then it goes to the oblique line of the thyroid cartilage, then it goes down to the cricoid cartilage, again it goes and fuses by splitting into two layers, okay, and it fuses with the this sternum, okay, and here it will form an space, and that space is known as suprasternal space, okay, that space is known as suprasternal space. So I think this is all about the deep cervical fascia, okay. If you understand, please subscribe the channel and share among your friends. Thanks for watching the video till ends.